Welcome to Cardiovascular Symptoms Part 2. In the previous video, Cardiovascular Symptoms Part 1, Essential Medical English Vocabulary, we covered the key medical terms, clinical collocations, and functional language you need before practicing. You'll find the link on the screen and in the description below. If you haven't watched Part 1 yet, I recommend starting there first, then come back to this video to practice everything covered. Ready with Part 1? Now it's your turn to take the patient's story and give it the correct medical name. Let's activate the vocabulary and clinical precision you learned in the previous lesson. Section 1. Match the patient's words to the medical term. 1. Patient says, "It feels heavy, like someone is pressing on my chest." What's the clinical term? Bingo! Crushing chest pain, used for possible cardiac ischemia. 2. Patient says, "I can't catch my breath when I walk, even a short distance." And this is called shortness of breath on exertion. 3. Patient says, "I can't lie flat. I need 2 or 3 pillows." Name the symptom. Orthopnoea. 4. Patient says, "The pain starts here and goes down my arm." What does that indicate? Radiating chest pain. Arm, jaw, shoulder. 5. Patient says, "My heart suddenly starts racing." Medical term, please. Palpitations. 6. "My ankles swell by evening. If you press them, the dent stays." What do we call this? Pitting edema. 7. Patient says, "I blacked out for a moment." Red flag term is syncope. 8. "My legs hurt after walking, but the pain disappears when I stop." This is known as claudication. 9. Patient says, "I wake up at night gasping for air to sit up and breathe." This symptom is called paroxysmal nocturnal dyspnea. 10. Patient says, "My heartbeat feels like it skips, then thumps strongly." Term, please. Irregular heartbeat or arrhythmia. 11. Patient says, "I cough up pink, frothy sputum." What complication is that? Pulmonary edema. 12. Patient says, "I feel dizzy when I stand up suddenly." This is called postural or orthostatic hypotension. Section 2. Choose the correct cardiovascular vocabulary. 1. The patient reports sharp, crushing, or itchy chest pain during exertion. Which one matches cardiac ischemia? Answer: crushing. 2. She experiences shortness of breath on exertion, on weekends, or on the right side. Which phrase do professionals use? Answer: on exertion. 3. The discomfort radiates to, hides behind, or avoids the left arm and jaw. Classic cardiac pattern. Answer: radiates to. 4. He feels his heart fluttering, melting, or cooling when climbing stairs. Which one describes palpitations? Answer: fluttering. 5. The patient cannot lie flat because of orthopnoea, dizziness, or tinnitus. Think. Lying flat triggers breathlessness. Answer: orthopnoea. 6. She has pitting, jumping, or floating edema in both ankles. Press the skin. Does the dent stay? Answer: pitting. 7. He fainted due to syncope, hiccups, or reflux. Medical word for passing out. Answer: syncope. 8. The leg pain worsens with walking and improves with rest, suggesting claudication, dehydration, or constipation. Peripheral artery disease clue. Answer: claudication. 9. The chest pain had a sudden, seasonal, or decorative onset. Fast onset is a cardiac red flag. Answer: sudden. 10. She describes a racing, freezing, or whispering heartbeat during anxiety episodes. Which one screams palpitations? Answer: racing. Now your home task. 1. Explain orthopnoea using simple English. 2. Ask a patient 3 professional questions about palpitations. 3. Take a brief cardiovascular history, any 4 questions from the lesson. Drop your answers in the comments below and we'll discuss them together. For more practice, comment "task" below and I'll send you a downloadable PDF with exercises. That's it for cardiovascular symptoms. Review these sections, practice regularly, and you'll build confidence and accuracy in any English-speaking medical environment. Next topic: gastrointestinal symptoms. Follow Medical English Pro.